action.
Okay, so we're gonna go unit 9, so the knee flexors, knee extensors. So for our CAM assessment, we're gonna have Sarah actively take her hip and knee to 90 degrees. We're gonna internally rotate and actively bring your heel toward your seat, Sarah. Good. We'll do a comparative look on both of these to see what the symmetry is. We'll just do one side for the video. Then we'll take her foot to neutral, reset her here, relax. Okay, now bring your heel to your seat again, Sarah. Make sure she keeps her hip and knee flexed to start with. Then we're going to externally rotate, take her into knee flexion, and see where that is. Again, a comparative assessment for her CAM bilateral look. So the next one we'll do hip and knee flexion to 90, then we'll actively extend the leg in neutral, making sure for compensation, again, a contralateral look. In terms of our testing for the hamstring musculature, we're going to start at 90 and then have her back off to 75 degrees. We're going to internally rotate the tibia, slightly abduct the hip. And then what I want you to do, Sarah, I want you to pull into my hand, hold, and relax. Hold, relax. Again, internal rotation, slight abduction. That's for semi-membranosus. Do a comparative look. Just for the sake of, so she's not turning back and forth, I'm going to do all the tests for semi-membranosus, tendinosis, biceps femoris, long and short head in supine, and then I'll do the defamats in prone so she's not back and forth. So that was semi-membranosus. Semi-tendinosis, we're going to keep same position, actively take her to 90, back off to 75 degrees. Hold right there, Sarah. Only now we're going to internally rotate and take her knee into 110 degrees knee flexion. Hold, Sarah. Hold. Good. So that's semi-tendinosis. For biceps femoris, again, hip flexion to 90, have her back off to 70 degrees, slightly abduct. We're going to externally rotate, and all these are with dorsiflexion of the ankle. And we're going to have her back off to about 70. Now, pull down, hold. Hold. So that's for biceps femoris long head. Short head, we're going to keep that same externally rotated tibial position. We're going to go 110 degrees of knee flexion for short head dorsiflexion of the ankle. Hold that external rotation, Sarah, and flex your knee. Hold. Good. So that's biceps femoris there. For our defamats, if we have her go prone for the hamstrings, for semi-membranosus, we're going to find the ischial tuberosity, the most medial portion, and do our digital force there off the medial side, the ischial tuberosity. Then we're going to come down distal to the joint line on that medial border right of the tibia and do semi-membranosus just below the joint line distally. Okay, that's for semi-membranosus. For semi-tendinosis, again, off the ischial tuberosity. A little bit more in that same posterior medial aspect. Then we're going to come down off the pes anserine. You can do this in supine, right off the pes anserine. Where the sartorius and gracilis also attached, but right off that semi-T, you can have her flex her heel, pull into my hand. There you go. And feel that medial hamstring group kick in right off the pes. For biceps femoris, ischial tuberosity, again, a little bit more lateral for the long head. We come down, find the fibular head. And palpate there. For the short head, we come off that distal third, posterior lateral linea aspera, more lateral. Pull here. You can feel our hamstrings there. Right here. Short head again, we go out to the fibular head and attach there. Go back to your back. So for our retesting, we'll go back into the same positions. Semimembranosus knee flexions, hip and knee flexion 90 back off to 75, internally rotate and hold. Okay, so we'll retest there, and then for our picks, relax here, keep that same position, internally rotated. Now just relax, Sarah. Now we're gonna hold, slide a little more abduction there. So hold, 10% contraction, 6 seconds for 6 times at 10%. For that's semimembranosus. Semitendinosus, again, 90 degrees of knee flexion to retest after we do our DFMATs. Back off to 70, 75. And then we're going to internally rotate, only take the knee into knee flexion to 110, hold, retest, okay? So for our picks there, hit 90, back off, internally abduct slightly, internally rotate at 110, relax there a minute, Sarah. Now hold 10% of that, just hold for 6 seconds. Repeat 6 times at 10%. For biceps femoris, again, hip to 90, back off at 75. Abduct and externally rotate dorsiflexion of the ankle and retest, hold. So that's for long head. For our pick, we'll have her maintain that position and then relax there, Sarah. Now just 10% of that hold for 6 seconds. Repeat 6 times, okay? For long head, same position, tibial external rotation, dorsiflexion of the ankle, slide abduction of the hip, 110 degrees of knee flexion. Bring that ankle up a little, sir, there you go. And externally rotate. Now retest, hold. That's for a retest after our DFMATs. Then our picks, we're gonna keep her in that same position, and then 10% of that, hold. So 6 times, 6-second holds for 10% contraction, and that's for biceps femoris short head. Okay. Moving into our hip extensors, tendons. So now we're going to go for vastus medialis. We're going to do the upper and middle and lower fibers on our testing, and then I'll do the DFMATs. Actually, in this position, I'll just do them one after the other because she doesn't have to change. So we're going to take her. What we're going to end up doing here is hip and knee flexion. We're going to take her heel to the level of, for the upper fibers, heel to the opposite knee. So what we're going to have is tibial internal rotation and abduction, extra rotation of the hip. And then, Sarah, I'm going to have you resist this motion. So hold. Good. Hold. So upper fibers of vastus medialis. So for the DFMAT there, tighten your leg here, squeeze your muscle. Okay, relax. We're going to get up on those upper fibers. Then we're going to come off the quad tendon, medial aspect, and then off the infrapatellar tendon to the tibial tuberosity for our DFMATs. We'll retest. External rotation, internal rotation of the lower leg, hip flexion, heel to the level of the opposite knee and hold, taking her into external rotation. Retest there. For our picks, we'll have her maintain that same position as before. Now you're just going to meet 10% of that, Sarah. 6 seconds for 6-second holds. Okay. For the medial fibers, we're going to take that heel, we're going to extend her hip to the level of the mid-tibial shaft, same externally rotated position of the hip, internal rotation of the tibia, and internal rotation of the foot, right, and we're going to hold there, hold. Test for weakness. For our DFMATs, squeeze your muscle tight. Okay, come into more of those medial fibers of the vastus medialis. Again, go into that quad tendon, medial aspect, into the infrapatellar tendon and tibial tuberosity. Retest. Heel at the level of the mid-tibia, externally rotated, knee flexed, hip flexed, hold. And then for our picks, maintaining that same position, 10% there, hold, just meet right resistance there. 6 of them, 6 times, 6-second holds at 10%. That's for the vastus medialis, intermediate fibers. For the lower fibers, we take her further into hip extension, still externally rotated at the hip, internally rotated at the foot, and we hold there. Come down to the medial fibers as we get to the obliquous fibers here. Pretty tender here, saphenous nerves running through here, so that's pretty tender. Quad tendon for our defamats. Again, infrapatellar tendon and tibial tubercle. And retest. Hold. Good. For our picks, take her to the same position, heel at the level of the other medial malleolus, externally rotated at the hip, internally rotated at the tib, tib femoral joint, and hold 10%, 6 times, 6 seconds for our picks. So vastus lateralis, again, we have upper, mid, and lower fibers of the vastus lateralis. We change this up. We're going to have internal rotation of the femur. We're going to have external rotation of the tib femoral joint. We're going to have plantar flexion, and then external rotation of the tib femoral joint. I'm going to get on the other side for this one. Okay. And then what I want, Sarah, I want you to resist. I want you to push out into my hand, so resist this internal hold. We're going to back off just a little bit. We're going to have this at the heel at the height of the other knee, just like we did with the oblique fibers. So hold. That's for the upper fibers of the vastus lateralis. So for our defamats, upper fibers, greater trochanter, tighten your muscle here, straighten, relax. So we're going to get in on the upper lateral fibers of vastus lateralis onto the femur. We're going to come into the quad tendon a little more laterally, superior pole of the patella into the quad tendon, into the lateral aspect of the patella, and into the infrapatellar tendon. And then retest. Heel at the level of, so internal rotation of the femur, externally rotated at the tibia, heel at the level of the opposite patella, and hold. Good. And then for our picks, again, we're going to hold that same position, 10%, 6-second contractions, hold. 6 times, 6 seconds for 10% contractions. For the intermediate fibers, we're going to take the heel to the mid shaft of the tibia, internally rotated femur, externally rotated tib fib. I'll stand on the other side of the table. Again, hold. So I'm pulling her into external rotation. She's trying to internally rotate. Find out weakness there. Do our defamats lower in the middle third of the femur laterally. Relax. Feel those lateral fibers. Quad tendon area, more lateral. Off this superior pole of the patella into the infrapatellar tendon. Okay. Now, final one for the lower fibers. Internal rotation of the hip, external rotation of the tib femoral joint. We're going to take her down to the medial malleolus and hold that. Hold, hold, hold. Good. For our defamats, we'll come in on the lateral aspect. Into the quad tendon and infrapatellar tendon. Retest. Hold. Good. For our picks, again, 6 of them, 6-second holds, internal rotation of the femur, external rotation of the tibia, and hold. Good. Do that 6 times, 10% contractions for 6-second holds. For vastus intermedius, hip flexion to 110, dorsiflexion of the ankle. We're going to do lateral and medial fibers. For lateral fibers, we'll have her externally rotated. hold that at 110, push into my hand, push. Find weakness. For our DIFA-mats, under the rectus femoris, so flex your hip here a little bit. We're gonna go those lateral fibers on vastus intermedius more laterally, trying to get under the rectus femoris. Retest, hip flexion 110, externally rotated at the tibia and hold. Good. For our picks, you can have her hold that, relax that for a second, and then now push into my hand with external rotation. Good. The medial fibers of vastus intermedius, 110 flexion, internal rotation, knee flexion to 110, and extend. Good. Again, coming on more the medial fibers just beneath the rectus femoris on vastus intermedius. We're going to DIFA-mat on quad tendon, infrapatellar tendon, just as we would with the lateral fibers of vastus intermedius and the medial fibers, quad tendon, infrapatellar tendon as well. Retest with internal rotation, hip flexion to 110, knee flexion 110, and then hold. Good. In our picks, hold that internally rotated position, knee flexion 110, and push 10%. Relax. 6 of them, 6-second holds, 10% contraction. For the articularis genu, we're going to go just slight knee flexion, and I want you to just straighten your leg into my hand here. Good. Relax. Come right off the suprapatellar pouch, and we're going to go all along the borders, both medial and laterally, of this superior pull of the patella, and then into the quad tendon as that muscle tendon junction comes down just above the patella and into the infrapatellar tendon, and then push out again, retest, and then for our pick, we'll just do, I just want you to lift your leg, good, 10%, just hold that, 6-second holds, 6 times for 10%.